If you have ever peed when you sneeze, felt pain during sex, or Googled, "Are my insides falling out at 2 a.m.?" you have been getting incomplete answers. And some of what you have been told is straight up making things worse. In the next 10 minutes, I'm going to share with you 5 things I wish every woman knew about her pelvic floor. These are the things I tell my patients on day 1 that completely change how they see their body, their symptoms, and what is actually possible for them. By the end of this video, you will understand your pelvic floor better than most healthcare providers could explain it to you. You have tried Kegels. Maybe you've tried ignoring it. You may have even brought it up to your doctor only to hear that is just what happens after having kids, or just have a glass of wine before sex. And now you are stuck somewhere between frustrated and embarrassed, wondering if this is just your life now. I am Dr. Gabi, a doctor of physical therapy and a pelvic floor specialist. I have spent nearly a decade helping hundreds of women fix the exact problems you are dealing with, and I see the same gaps in understanding time and time again. Here are 5 truths about your pelvic floor that nobody's putting together for you in one place. And number 5 might just be the one that changes everything. Number 1, leaking is common, but it is never normal. One of the most damaging things women hear is, "A little leaking is normal after having kids," or "That's just what happens as you age." Common does not mean normal. Leaking urine, whether it is a drop when you sneeze or a full bladder loss when you run, is never normal. It is a sign of pelvic floor dysfunction. Not a life sentence, not a personality trait, but dysfunction, which means it can be addressed. Here is what gets me fired up. There's no such thing as a weak bladder. That phrase just needs to fall off the face of the earth. I hear this all the time in my clinic. Women come in saying, "I just have a weak bladder," as if their bladder was the problem. But the bladder is almost never the main issue. It is the pelvic floor muscles that control and stop the flow of urine. That is a completely different conversation, and it opens up a completely different set of solutions. Think of it this way. If your faucet was dripping, you wouldn't blame the water, you would look at the valve. Your pelvic floor is the valve, and that is where the real fix happens. If you're currently wearing a pad just in case or avoiding certain exercises because you might leak, that is your signal that something is off, and it is fixable. But here's the thing. Most women who realize leaking is not normal go straight to the most common solution out there. And that brings us to number 2, which might surprise you. Number 2, Kegels are not the answer to everything. This is the biggest misconception in pelvic health. Kegels have become the default recommendation for every pelvic floor issue. Leaking, Kegels. Prolapse, Kegels. Pain with sex, Kegels. But here is what most people do not realize. If your pelvic floor muscles are already tight, tense, or overactive, doing Kegels is like clenching a fist that is already in a fist. You are making the problem worse. I recently had a patient come in the other day who was told by her birth provider to do 100 Kegels every single day to prepare for labor. 100 per day. That advice could have made her delivery significantly harder because of the muscle tension it would create. In my clinic, a large number of the women I treat for pain with sex have overactive pelvic floors. Their muscles are holding on too tightly. Telling them to do Kegels is the opposite of what they need. They need to learn how to relax and lengthen those muscles, not squeeze them harder. Imagine you have a really tight knot in your shoulder. Would the fix be to flex your shoulder as hard as you can 100 times a day? Of course not. You would want to release the tension first. The pelvic floor works the exact same way. If you have been doing Kegels and your symptoms have not improved or they've gotten worse, stop assuming you just need to do more. That is your body telling you that Kegels may not be the right tool for your situation. Now, if Kegels are not always the answer, the obvious question becomes, what actually is going on down there? And this is where most women are missing a huge piece of the puzzle. If you're watching this and thinking, "Why has nobody explained this to me before?" you are not alone. I break down pelvic health in a way that actually makes sense every single week on this channel. Hit subscribe so you don't miss the next one. Number 3, your pelvic floor does way more than you think. Your pelvic floor is not just about bladder control, not even close. The pelvic floor is a group of muscles at the base of your pelvis that support your bladder, your bowels, and your reproductive organs. It helps manage pressure inside your body every time you lift, cough, sneeze, or exercise. It plays a role in your posture, your lymphatic system, and is absolutely central to sexual function and pleasure. When the pelvic floor is not working well, the symptoms can show up in places you would never connect it to. I have had patients come in for what they thought was a hip problem, only to discover pelvic pelvic floor dysfunction was the driver. I have solved bladder leakage in runners by treating their mid-back, their calves, their feet, and their ankles, not by giving them a single Kegel. The pelvic floor does not exist in isolation. It is connected to your entire body. Ask yourself these 3 questions. Do I have symptoms in more than one of these areas? Bladder, bowel, or sexual health? Have I been treating one symptom at a time without looking at the bigger picture? And do my symptoms get worse with stress, certain postures, or specific types of exercises? If you said yes to 2 or more of these, your pelvic floor is likely the common thread. And here is where it gets really interesting. There is a connection between your pelvic floor and a body part you would never expect. And understanding it can change how you approach pain, tension, and relaxation immediately. Number 4, your jaw and your pelvic floor are connected. Use it. This is the one that surprises everyone. Your jaw and your pelvic floor are linked through a fascial connection that runs through your entire body. Fascia is connective tissue that wraps around everything inside your body, your muscles, your organs, your nerves, and there is a direct fascial line from your jaw down to your pelvic floor. That means when you clench your jaw, hold tension in your face, or grit your teeth, your pelvic floor responds by tightening too. This is huge for anyone dealing with pain, tension, or difficulty relaxing their pelvic floor. I see this pattern constantly. Women who clench their jaw during the day, grind their teeth at night, or brace their face during stressful moments are unknowingly keeping their pelvic floor in a constant state of tension, and they have no idea why their symptoms are not improving. Here is what to stop doing. Stop clenching your jaw when you are stressed, when you are exercising, and especially during sex. Here is what to start doing instead. Throughout the day, take mindful moments to scan your body. Let your lips close, but let your teeth part slightly. Let your tongue rest gently on the roof of your mouth. Drop your shoulders. Take a deep breath in and imagine your pelvic floor opening and lengthening as you inhale. This simple awareness can start to shift tension patterns you have been carrying for years. Now that you understand what is happening in your body and how these systems connect, there is one more thing I need you to hear. And honestly, this might be the most important part in the whole video. Number 5, your body is not broken, but it does need the right inputs. There is a lot of fear-mongering in the pelvic health world, especially in the pregnancy and postpartum space, and I need you to hear this clearly. Your body is resilient. It can adapt. It can heal, but it needs the right inputs and strategies to do so. Not generic advice from the internet, not a one-size-fits-all Kegel program, and certainly not a machine that claims to fix stress incontinence in 6 visits. The women I work with who get the best results are the ones who get an individualized assessment, understand the root cause of their specific dysfunction, and follow a plan built for their body. Think of your body like a house. If the foundation is off, you could repaint the walls all day long until you're blue in the face and nothing would change. You have to look at the foundation. This is what a root cause approach does. It stops treating symptoms and starts addressing what is actually driving them. Tonight, I want you to try this simple 3-minute practice before bed. Lie on your back with your knees bent and your feet flat. Place one hand on your belly, one hand on your chest. Breathe in slowly and feel your belly, your ribs, and even your back expand. As you inhale, imagine your pelvic floor gently opening and relaxing downward. Exhale naturally and let everything settle. Do this for 10 slow, deep breaths. That is it. This is called diaphragmatic breathing, and it is one of the most powerful tools for releasing pelvic floor tension and reconnecting with your body. It takes 3 minutes and you can start tonight. This works because the diaphragm and the pelvic floor move together. When you breathe in properly, your pelvic floor naturally lengthens and relaxes. You are retraining a coordination pattern that impacts bladder function, pain levels, tension, and even bowel health. It is not a magic fix, but it is the foundation that everything else builds on. Your pelvic floor is not a mystery, and your symptoms are not something you just have to live with. The women who get results are the ones who stop guessing and start getting right answers for their specific body. You now know more about your pelvic floor than most women ever learn. Use it. If this video opened your eyes, share it with a woman in your life who deserves to know this information. And go explore the rest of the channel. There is a lot more from where this came from. I will see you in the next one.